Good morning, my dear children. Today we will be discussing on one of the important poison which is widely used, whether it you name in the industrial component or in the agriculture or in the medicinal values. But at the same time, it has many side effects and many problems are there with this. We have to be very careful with this chemical. That is organophosphate and carbamate poisonings. Organophosphates are widely employed both in natural and synthetic applications because of the ease with which organic groups can be linked together. These are multiple chemical products. Multiple chemicals become a single product and they kill the germs and infections are controlled. At the same time, they have many lethal side effects. They are the basis of many insecticides, herbicides and nerve gases. They are also widely used as solvents, plasticizers and extreme pressure additives. Medical importance uses of the organophosphorus compounds. Organophosphates, pesticides degrade rapidly by hydrolysis on exposure to sunlight, air and soil. Their ability to degrade made them an attractive alternative to the persistent organochloride pesticides such as DDT. Although organophosphates degrade faster than the organochlorides, they have greater acute toxicity, posing risk to people who may be exposed to large amounts, especially the farmers who spray it in the open fields. From morning to evening, they will be spraying in the fields, and by the time they are exposed completely. Insecticides and nerve gases, organophosphates, pesticides, as well as serine and VX nerve agents are irreversibly inactive, activate acetylcholinesterase, which is essential to nerve function in insects, humans and many other animals. Organophosphate pesticide affects this enzyme in varied ways and thus in their potential form of poisoning. Introduction of organophosphates. We have discussed that where all it is being used. Apart from the normal uses like a pesticide and herbicide, it is also used as a nerve gas, war nerve gas, wherein these gases are sprayed in a wide areas in the wars. In 1942 war it has been used and many people have died because of that. And now let us come to the real facts. Organophosphates and carbamates are potent cholinesterase inhibitors capable of causing severe cholinergic toxicity following cutaneous exposure, inhalation or injection. Worldwide, more than 30 lakh per year are exposed. 30 lakh people are exposed, which is a very huge number. Up to 3 lakh fatalities. 15 to 18% of all poisoning cases in Aleppo. Chemical weapons, that is the nerve gas weapons, are organophosphate agents only. Mechanism of action. Organophosphorus compounds bind to the acetylcholinesterase enzyme and overburden of acetylcholinesterase in the synapses, resulting in by the time the compound undergoes a conformational change, that is aging change, render the enzyme irreversibly resistant to reactivation. Carbamate compounds, unlike organophosphates, are transient and cholinesterase inhibitors. Clinical features. There are many wide range of clinical features. Generally, oral or respiratory exposures result in signs and symptoms within 3 hours. Even sometimes we find the symptoms within half an hour also. While symptoms of toxicity from Dermal absorption may be delayed up to 12 hours. Clinical features, generally manifestations in minutes to hours, evidence of cholinergic excess action. That is, first one is the sludge, salivation, lacrimation, urination, defecation, and gastro-emptying. These are all the easily rememberable symptoms of the organophosphate poisoning. Next one is BBB, bradycardia, bronchoria, and bronchospasm. Respiratory insufficiency can result from muscle weakness, decreased central drive, increased secretions, and bronchospasm, and it is the lead cause of death. Cardiac arrhythmias, including heart block and QTc prolongation, may be due to hypoxemia. This is how the action takes place. Everywhere, acetylcholinesterase enzyme is the one which is going to be affected. In children, seizures are more common. Lethargy and coma will be there. Flaccid muscles, weakness, and meiosis will be there. Excessive salivation are common presenting signs in the children. 10 to 40% of the organophosphorus agents poisoned patients occurs 24 to 96 hours after the exposure. Bulbar, respiratory, and proximal muscle weakness are prominent features. Generally resolves completely in 1 to 3 weeks if treated well. Organophosphorus induce delayed neuropathy, that is opidin symptom. Specific organophosphorus agents act on a specific activity. Usually occurs several weeks after the exposure. Primary motor involvement, symmetrical motor, polyneuropathy, flaccid weakness, or lower extremities ascends to involve upper extremities. It is a very classical symptom. Classical development of the symptoms is seen in this after few weeks of the exposure. Sensory disturbances are usually mild, may resolve spontaneously, but can result in permanent neurological dysfunctions. How to diagnose this? 88% of the parents initially deny any exposure. Petroleum or garlic-like odor is present in their breath as well as on the body also. If doubt exists, a trial of atropine 0.01 to 0.02 milligrams per kg may be given in the patient. The absence of signs or symptoms of anticholinergic effect following atropine challenge strongly suspicious the diagnosis. RBC acetylcholinesterase activity provides a measure of the degree of toxicity, determining the effectiveness of the antidote therapy. Plasma or pseudocholinesterase activity more easily performed, not correlate well with the severity of the poisoning. A depression of 25% of more is strongly evidence of excessive organophosphate absorption. Do not delay the treatment until laboratory confirmation is obtained. Don't wait for the laboratory reports. The best thing is give milder dose of atropine and you can find the changes. And if you find the changes, then go ahead with the atropinization and other treatments. Management, initial resuscitation, deliver 100% oxygen via face mask. Strongly consider intubation. Patients who appear mildly poisoned may rapidly develop respiratory failure. Consider volume resuscitation with normal saline or ringer to treat bradycardia and hypotension. Use activated charcoal with 1 hour of an injection. In cases of dermal exposure, aggressive decontamination of the complete removal of the patient's clothing and vigorous irrigation of the affected area should be performed. Complete with acetylcholine at muscarinic receptors. Initial dose of 0.05 milligrams per kg IV bolus should be given. Doubled every 3 to 5 minutes until bronchial secretions and wheezing stops. Repeat every 10 to 30 minutes until all absorbed organophosphate metabolized few hours to several days, usually 2 to 12 hours. Atropine. Keep a maintenance dose of atropine for 2 to 3 days after dispensing of all the manifestations. Tachycardia and mydriasis are not appropriate markers for the therapeutic importance, as they may indicate continued hypoxia, hypovolemia, or sympathetic stimulation. Fever, muscle fibrillation, and delirium are the main signs of atropine toxicity that indicates that atropine administration should be discontinued at least temporarily. You find atropine is the treatment of choice. At the same time, atropine is also dangerous in other side. So you have to administer it with due care. Treatment with pyrrolidoxin, cholinesterase reactivation agent that are affecting in treating both muscarinic and nicotinic symptoms. Use within 48 hours after poisoning. Use with concurrent of atropine. Use only for moderate to severe organophosphate poisoning and not for carbamate poisoning. Use if neuromuscular dysfunction is present. Management with pyrrolidoxin, 25 to 50 milligrams per kg IV in 100 ml of normal saline over 30 minutes. Repeat after 1 to 2 hours, then every 10 to 12 hours interval of if needed, or continuous infusion at 10 to 20 milligrams per kilogram per hour. Monitor blood pressure during administration, because this drug is going to act very badly on the blood pressure. Management with benzodiazepine. Prophylactic benzodiazepine has been shown to decrease neurocognitive dysfunctions after poisoning. Diazepam 0.1 to 0.2 milligrams per kg IV, repeat as necessary if seizures occurs. Phenytoin has no effect on organophosphate agent induced seizures. Special considerations. Organophosphates are usually dissolved hydrocarbon bases. Thus, the clinician should consider hydrocarbon pneumonitis and not to do gastric lavage. Postmortem findings, very important. This is where we need to be very concentrative. Externally, cyanosis is present very clearly. Internally, garlic-like or kerosene-like smell is present in the stomach and even in the lungs and every organs. Pulmonary edema, diffuse pulmonary edema will be there as if congestion is heavily dominant. Petechial hemorrhages seen everywhere in all the internal organs. Organophosphorus can be detected in highly decomposed bodies also. Medico-legal importance. Accidental poisoning of children. Children try to consume this poison unknowingly as it is as a poison. Usually seen in the villages where farmers use for their fields, and unfortunately children consume it. Occupational exposed among adult farmers, workers, and secondary accidental exposure to their families can also occur. Suicide attempts probably account for more severe and more frequent poisoning. Medico-legal importance. Exposure of the general population through the consumption of foodstuffs treated incorrectly with pesticides or harvested prematurely. This is mostly seen in the agricultural products bought from the farming, and they are not washed thoroughly after bringing it to the home. 99% of the agriculture we see usage of these organophosphate compounds. But once you bring it to home, it has to be washed thoroughly and it has to be consumed. Accidental poisonings can also occur through failure to absorb the safe re-entry time after applications. Occupational exposed population. The factory workers who are in the production of these compounds are accidentally exposed. Workers involved in formulating and dispensing pesticides. Agriculture spray workers, crop harvesters during disease vector control period. Public health workers involved in vector control. Health workers not following the correct procedures when handling poisoned patients, especially when ventilator support is needed. Environmental risk, most important. 3 routes of entry in water resources: industrial waste or effluents, seepage from the buried toxic waste into water supplies, contamination of running water directly. These are the 3 types of environmental pollution which has to be controlled very carefully. And most important thing is, it is carcinogenic, they are tetragenic and mutagenic. So very dangerous, and it should be carefully treated. So in summary, reduce the use of organophosphate and organocarbamate compounds as far as possible, minimize to the natural methods of pesticides and herbicides. Reduce exposure. Whenever the farmers are doing field spray, they should do it for a shorter time and take a long gap and again do it, rather than exposing it to continuously for hours. Seek alternatives. 3/4 integrated pest management, that is IPM. Very important, minimize the usage of the pesticides. For the same pest, yesterday we were using 10 ml, today we are using 20 ml. We should not do such a way, right? And try to convert to other types of pest managements. Beware of local and global usage. Thank you and wish you all the best.